which Dylan Burns discusses vaccine mandates and if they are not racist with a conservative discussion panel. I guess is probably a good way of characterizing this one. And the reason I call it a discussion panel, not a debate panel, is because Dylan is the only one defending his side of the argument, or on his side of the argument is probably a better way of presenting that. So there's a number of points that get brought up here by both sides, and I wanted to analyze them in the sense of like, okay, so where's the rationale coming from? What are the flaws in their reasoning and logic? And in some ways, if this comes up, because I don't know if it comes up in this one, but like debate panel or debate rhetoric, and then like pivoting away from questions and stuff like that. So like I will do with every video that I discuss on this channel, but without getting too much more into it, let's just go ahead and start.
What actually happened to me? Two
Mr.
people
Dylan
without them
Burns.
fucking just saying, "Oh, that didn't happen." Oh, well, looky here.
Hello, everybody. How's it
Speaking
doing?
of devils,
Devils.
Dylan, what's up?
Starting off a little spicy.
Redneck, you have a heart condition?
A little much?
Yeah.
You do?
Yep.
Yeah, I did as well. I had the atrial septic defect whenever I was born. I had open heart surgery at 11 years old. Taking that vaccine would be a fucking murder.
I have what they call a enlarged lower chamber and a valve that likes to do some funky shit. And that was not, there was no symptoms of that. I don't have the same shit in my family. So the military rates my heart condition at 30% back when it first happened, they had it at 30%. So the
I was
government
not
saw
able-
something there.
I was not able to join the military because I have a scar from here all the way down here.
Fuck sakes, bro.
At 11 years old, I had open heart surgery. I was enabled because I tried to fucking convince a Navy corpsman to let me join the military, and no, not gonna fucking
Hey,
happen.
what's up, Derek?
Okay, so the point here is basically they're bringing up medical conditions and how if I have a certain medical condition that compromises my immune system, taking the vaccine would kill me because in some cases taking the vaccine would kill people who are immunocompromised. The problem here is that this idea that they would make you take the vaccine if you're immunocompromised, and they can tell that you're immunocompromised by tests and your medical records, and then make you take the vaccine knowing that it would cause you harm is kind of weird to me, because this is kind of the point of having medical records, is so they don't do something like that. So it's interesting that this is even an argument, in my opinion. But coming from that perspective, so the rationale here is, well, I have a condition, and the condition means that taking the vaccine would hurt me, if not outright kill me. But what's interesting here is this is they point primarily to like the side effects that the vaccine causes. So one that gets brought up all the time is the myocarditis, right? The inflammation of the area around the heart. Now, is it true that one of the side effects for the vaccine is myocarditis? Yes, 100% true. That is a side effect. However, it is the number of people who develop this condition is relatively small compared to the number of people who've been vaccinated. On top of that, it is acute, which means it's temporary. On top of that, this is and here's the part that I think they don't understand when they bring these things up. Every side effect of the vaccine is also a side effect of getting the virus. However, the odds of you having that side effect are significantly higher if you catch the virus versus if you get the vaccine. And by significantly higher, I mean somewhere between 5 and 7 times. So in this specific case, 5 and 7 times more likely if you get the virus versus getting the vaccine. So, and this gets brought up in another video, which I'll go over at a later point. But this is the flaw in the argument here is, well, yes, the vaccine has these effects, but the virus also has them, and it has them at a significantly higher rate. And not only are you more likely to have a side effect from the virus versus the vaccine, But the virus also causes long-term conditions that we know and have documented because the virus was around for basically 2 years before we had the vaccines. And you develop long-term conditions almost immediately. And so this is where the this is where the poisoning stuff kind of cracks me up, right? So like one of the arguments against the vaccine is like, oh, 6 months down the line you develop conditions. So it's like, no, that's not how poisons work, right? Like, I don't want to get too far into that because that's not a point they're making. But like, it's interesting to see where this argument comes from, and that like, well, if I get the vaccine, I'm definitely going to get these side effects, right? But if I don't get the vaccine, I only have a possibility of catching COVID, and despite the fact that the side effects from COVID are worse, it's this strange way that they look at these things. And so why I bring this up is there's research on the way conservatives look at problems, right? And so what's interesting is when they look at how to solve an issue or a problem, it's an all or nothing approach, right? If you can't completely stop this thing from happening, there's no point in trying. And again, this isn't 100% true, but this is how this stuff tends to skew, right? So a good example is abuse of something like the welfare system, right? If people on welfare are using it for drugs or gambling or whatever else, they shouldn't get that money. It's like, oh, okay, that's a fair statement. How do we test for that, right? And so the drugs is their main concern. So the solution to this is, oh, you have to take a drug test prior to receiving a welfare check, right? And so this has been done multiple times in multiple states, and what always ends up being the case is they spend more money on implementing the drug tests than they save by weeding out people who take those tests and pop positive for drugs, right? And so this then creates an interesting discussion in there, in that, okay, so is the point we don't care how much it costs, we just don't want people in these systems that are meant to help people if they're using the resources that we give them for these bad things? Or is it we don't want these people receiving this money because it's a waste of money to give it to people who are going to use it for those things, and we don't want to be wasting the money, right? And so the vast majority of the discussion on this is, oh, it is the second reason I gave, right? We don't want to be wasting resources, okay? But by testing for drugs, we before giving out welfare, it ends up costing more. So the opposite is true, right? Yes, there are people who abuse systems of welfare assistance by using the money that or the resources that they're given to get drugs. The problem is that it's such a small portion of them that to weed them out, to not give them that assistance, you were spending more resources than you were saving. So it makes sense from one angle, but not the other. And the other is the main justification they use for the policy in the first place. But so again, here, back to the discussion at hand, I have a medical condition, therefore I shouldn't have to take the vaccine. Well, okay, that's already accounted for, right? That's like if you went to your doctor and you're like, oh, I have diabetes, and they're like, well, we don't care. Here's this medication to help you with your headaches, and you have to take this for your headaches, despite the fact that it hurts people who have diabetes, right? Like that's the point of having medical records. It's the point of seeing a physician before you do something like this. That's why you consult with doctors on these things in the first place, is so they can take the entirety of your personal situation into account before prescribing medication or telling you need to get vaccinated, right? Which, by the way, is something that gets taken into account if vaccine mandates were to become a thing, right? That's like saying, oh, yeah, if the government mandates driver's licenses and I can't drive because of a condition, like, sorry, that's a bad example. How do I draw a parallel with this? Okay, I don't have a parallel right off the top of my head. I have to think about it for a minute. But the point being, like, there is no governmental system that would mandate vaccines and then not care that you taking the vaccine would hurt you or kill you. Like, that's absolute insanity. And so if that's your defense for, like, why you don't get vaccinated, well, then you wouldn't be required to get vaccinated under a mandate anyways.
What's up, Dylan?
He just got back. What's up, Dylan? How you
Oh.
doing, buddy?
What's up? What's up, Dylan?
I'm doing okay. I just got another Diet Coke. I slam these things, man. I slam them.
Okay, they could.
Yeah, I can't.
Scared of the fake stuff.
I voted for Hunter Biden's dad.
And what's
Okay.
the new? What's
Here
the
we go.
new? Kind of tell us conservatives what's the new approach with the left? How can we actually have real debate and actual conversations and move things forward instead of just throwing shit at each other like we're at the zoo?
Probably shouldn't call people racist.
Okay, so this is an interesting question that he's asking because now, granted, I don't watch a lot of conservative discussion on these things because a lot of things that they say just infuriate me. But it's interesting that this is a question being posed from this side of the argument because the vast majority of stuff is that they use against certain things is personal attacks, right? Okay, so the Hunter Biden's dad shirt that Dylan is wearing, right? The argument against Joe Biden as a presidential candidate on that front was, oh, look at the things his son is doing. Well, okay, but is Hunter Biden the one who's running for president, or is it his dad Joe Biden? And is his dad Joe Biden responsible for his actions, or is Hunter Biden personally responsible for his own actions, right? And I know that's not the entirety of the argument there, but that's the overall premise, right? It's like, oh, Hunter Biden's doing these terrible things. This should reflect poorly on his father, and it's like, oh, okay, but that's personal, right? What does that have to do with Joe Biden's policies? What does that have to do with Joe Biden's politics? Whereas on the other end, and they say this in comparison, like, oh, well, they talk about, Ivanka Trump, and it's like, well, wait, but the discussions on Ivanka Trump are how much of what she has received is because of the position that her dad is in, not look at her behavior, should her father be responsible for it, right? So I always find this interesting when they bring up these points, like, okay, so how can we move things forward and not make this personal? When the vast majority of people making it personal are on their side. So
Probably one I'd throw just randomly call people racist at least.
Oh no, here it goes. Again, I'll tell you. Your ideology and what you're pushing is racist.
Okay, so this statement is interesting because what he's saying is your ideology and what you're pushing is racist. So what he's specifically talking about is the vaccine mandates, right? So it's interesting, and this is the really, really frustrating part for me, is when we talk about specific stances on specific policies, we then try and bring in ancillary stuff, right? We try and paint the entire viewpoint with whatever we ascribe to their view on this policy, right? So what they're going to say here is, if you want vaccine mandates are racist, and if you want vaccine mandates, you're racist. Which, okay, there's a through line there, but then they extrapolate even further. If you want vaccine mandates are racist, and therefore your entire ideology is racist. Well, no, that's not a consistent. That is not a logical conclusion to that statement, right? Yes, you can want to push something, and yes, that thing can be racist, but that thereby does not mean that everything that you believe is racist, that everything you want to implement is racist, right? That there's no logical consistency there. And both sides do this. It's incredibly infuriating, right? Like, oh, this thing you want to do is fascist, therefore everything you want to do is fascist, therefore your entire ideology is fascist. No. And this is why it's so important that we talk about these points on an individual basis. And actually, I believe we shouldn't even be discussing people's ideologies outside of the individual policy, right? Now, that may inform you about how they're going to look at solutions and problems in general, but I don't care about that, right? If we solve problems one problem at a time, not through a wholesale implementation of, well, if we want to do this with this policy or this problem, we therefore have to approach every problem that we have in the same manner. Well, no, that's not how that works. So why do we even bring that up when we're discussing these things?
Because it's being forced upon people that we all agree are the primary. Like, you didn't debate this fact with me at all. You agreed that, like, if the black family decides not to fucking take the vaccine, they have a reason, right? Do you agree with that?
Sorry, all I can hear is goose stepping in my head right now, but I hear you. Yes.
Do you agree with it?
Do I agree with you on what specifically? That black people what?
That the reason America has a 70% plus rate of black America that's not vaccinated, does that not trouble you?
Oh, it troubles me.
Yeah, I'm actually.
Do you know why they
cover
don't?
this chat.
Do you blame them?
Do I blame them? I mean, I'm
Yeah,
sure
for
there's
not getting
I'm
vaccinated.
sure there's individuals within the black community who haven't gotten vaccinated because
70 plus percent.
can you not? Okay, redneck, you gotta let me explain my positions before you jump down my throat.
Okay, they're gonna make some.
I
good
do
jokes
like
here,
men
which-
jumping down my throat, but not you. Okay. So the thing is, I think that there's a bunch of different reasons. I've been part of vaccine pop-ups in my community, which is a majority.
Oh
Black.
wait, I'm sorry. I should probably go over this before I get to Dylan's explanation. So let me go back a little bit. Okay, so the point here is well, if a policy affects a minority group more than the rest of the population, that is a racist policy, and that is technically accurate, right? The problem here is that this disregards whether the policy positively impacts them or negatively impacts them, right? So something like redlining is a negatively racist thing because it kept black people from buying houses wherever they wanted. It relegated them to only being able to buy houses in certain areas because the country was so racist at the time that a black person owning a house in a neighborhood dropped the property values of all the other houses of all the other properties around it just because they were black, right? And then thereby relegating them to only these neighborhoods so that they don't hurt the property values of other neighborhoods, which were primarily white neighborhoods. That is racist because it keeps them from being able to live wherever they want to live, and it doesn't allow them to buy houses that are worth a certain amount. And because this is a cyclical thing, it keeps certain neighborhoods, it keeps the property values of certain neighborhoods low and allows the property values of other neighborhoods to stay high. And that is the primary driver of most people's wealth, especially at that time, right? Most families' wealth was from the house that they owned and the value that property gained during their lifetime. So that's racist because there's a negative impact on a minority group, right? But in opposition to that, would you say reparations are racist? Well, under this definition, technically, right? And reparations are, we should financially, I don't want to say reimburse because that's not the right word for it, but we should give, financial restitution. We should give financial restitution to descendants of slaves because what we did to the slaves set them back financially by X amount at that time, which equals this amount by this date, blah, blah, blah. But so would that be a racist policy? Well, under their definition of what racism is, yes, that would be a racist policy, despite the fact that it is beneficial, right? So, and this misunderstands the point of calling a policy racist, right? Welfare. Would you call welfare racist? Well, in the negative manner, no. Despite the fact that a larger portion of minority families receive welfare than white families, right? Under their definition, welfare is racist, but it's an assistance program, right? So we don't care that it has that it affects the minority communities more because it's assisting them. We're not keeping anyone from doing anything. We're not preventing them from being able to do something that they want. We're helping them. So we don't that shouldn't matter, right? And that's the point of a critique of a racist quote unquote policy, right? It's not whether it impacts a minority group more or less than more, right? Because that's what racism technically, or a racist policy technically means, is that it impacts a minority group more. We care when it negatively impacts a minority group more because we don't. In the same way, like, okay, that's like saying sports is racist, right? The vast majority of professional athletes are black. Do we call sports racist? No. Why? Because being a professional athlete is a really good way to make money. So, do we care that the majority of athletes are black? From a financial perspective, no. I mean, you can talk about like social norms and pathways to wealth. Like there are some ways in which like you want to analyze that and examine why that's the case, right? But this isn't something that we would call racist because the impacts are positive for those people, right? So calling a vaccine mandate racist is an interesting argument because the point they're trying to make is, oh, well, it impacts the minority community more. Okay, but the vaccines have a positive effect. Now, what I get what he's doing with this argument is, and this is the counter to the other side of this, right? So what I find interesting here is the left, and I hate using these terms, but because I have to use their vernacular with this stuff, right? So, I shouldn't even say the left, right? So there's a lot of articles, there's a lot of stories, there's a lot of people, commentators who rail on conservatives, on red states specifically, for having high populations of unvaccinated people, right? You hear about this constantly from everyone who holds this view that people should get vaccinated, right? And yet, the point Redneck makes here is, wait, 70% of the black community is unvaccinated. Why? And so my question here is, why don't these two things get talked about in the same way? Well, Dylan is going to explain why the black community has their justifications for this high number of unvaccinated people, and some of it I understand and I can agree with. However, this still does not answer that question. Well, if this community gets talked crap on all the time because they have high unvaccination rates, but this community also has high vaccination rates, why do they not get the same crap talked on them? Which I don't think actually gets answered here.
I'm fine. So, vaccine pop-ups in my community, which is a majority black county, Prince George's County, and most of the conversations I've had with them, it was, well, I didn't know where to get vaccinated, or, well, I haven't got around to it. I didn't know how to do it really. I thought I had to bring my ID. I didn't have that. I thought maybe I need my birth certificate. Or just people not having access, not knowing where to go to get vaccinated. Some people thought it would cost money and they didn't want to pay the money, and there was like they didn't know that. And I'm sure there's people also who are against it for ideological reasons. But I think this idea of just painting everybody, and of course there's probably some for medical. But this idea of painting them all like, hey, they're all just a bunch of like anti-vaxxers, I think that's silly. I think there's a bunch of different reasons why people haven't gotten vaccinated yet.
Okay, hang on a second. Do you agree that 70+% of black America is not vaccinated?
Motherfuckers.
I can look up that statistic quick. I don't know the exact number. What percent of black are not vaccinated?
I hate to say it, but what he's searching up right now is already media biased.
I hate this argument. I hate this argument. Yes, it's media biased, okay? But you can find media biased sources on the other end of things. So if your concern is that it's biased, you can find bias on the other side of it too. And if you want to present conflicting pieces of data, do it, right? But this idea that it's biased, therefore you can't count it at all. No. Secondly, you can prove bias. You can prove bias, right? So I hate this argument.
Oh, really?
It's an opinion, but I think what he's already looking up is media bias. Period.
Wow. Well, then I think.
What you got, Dylan? What number you got?
Yeah. I'm 72% of the population. No,
72%?
wait. 72% of the population is vaccinated. Let me finish.
America.
Okay, so.
America.
I'm trying to find specifics for race, but you know what? I'll just grant it. For conversation.
Okay, so this is good for argumentation's sake because this is steelman, right? I'm going to say that your point is not only valid, but I'm going to argue from your argument's point of greatest strength is how I should phrase that, right? Because the problem is it's really easy to argue against the silly notions that get brought up, right? But what you want to do is the best way to demonstrate that your policy, your view is the most sound, is to argue it against the strongest opposition to it. Now, don't grant now, and this isn't to say that when you have these discussions, you should always grant them everything that they're saying, because some of this stuff is very easily and demonstrably untrue, and you want to be discussing these things from using accurate facts and information. But more often than not, granting them statistical information doesn't harm the argument that you make, because if your rationale or your policy prescription is sound, it doesn't matter what the statistics are specifically. Necessarily, I should say.
I don't want you to be charitable for any reason, because that's where my racism charge is based on our government and the current administration, and you support them wholeheartedly. And I'm saying
Wholeheartedly.
that because
Okay, so and this is again the broad paintbrush thing, right? If you agree with this one policy that this person wants to do, you agree with everything they're trying to do, and if you agree with everything that they're trying to do, you support them completely and unquestioningly. It's like, well, no, and this is incredibly frustrating for me, because again, I don't care what your political leaning is. I don't care what your political affiliation is. This is why we discuss individual problems and how to solve them with specific policies. So why does it matter if Dylan Burns supports this administration wholeheartedly and believes in everything they want to do? You're not talking about that. You're talking about this specific problem, and you're talking about the solutions to this specific problem. So these factors that you're bringing in to paint him in this light don't matter. Who cares? And okay, I'm sorry. And the reason why this infuriates me is because these are emotional arguments, right? And my problem with emotional arguments are two things. One, this is the easiest way to sway people, because all it requires is that you tell a story that plays to their emotions one way or the other, right? Two, it does not require accurate statistics. It does not require logical trains of thought, and it doesn't require a policy prescription, right? Because all you're doing is telling a story, and then using that story to then make your prescription sound appealing, or their policy prescription sound unappealing. And this is utterly pointless, right? When we talk about policy, like political policies, what we should be looking at is how does this impact the population at large, or the group of the population that deals with this issue that we are trying to address, right? And that's not to say that emotional reasoning, emotional arguments are pointless. They're not. They have their place. They just don't belong in politics, right? And this is frustrating from the other side of this too, because as I talked about with conservatives, in regards to liberals, right? With liberals, they're easily swayed by sob stories. This is why news channels will run pieces on, like, oh, this boy had cancer, and his neighbor put up a lemonade stand, or his neighbor's child ran a lemonade stand and helped raise money for his cancer, right? And it's like, oh, it's such a heart-touching story, right? Well, that's manipulative, right? That's emotional arguments, right? Because to me, what I think of when they tell me, oh, this boy had cancer and the neighbor boy had to raise money to get his cancer treatment. Well, wait a minute. Why is a 12-year-old raising money to treat some kid's cancer? Why does our system not just pay for that kid's cancer treatment, right? Wealthiest country in the world, and we can't pay for a child's cancer treatment? Just out of pocket? Like, it... But yeah, so like, again, the issue I have with this is this does nothing to... Because it's an individual story, right? And policy should not be based on individual stories. It should not be based on the impact it has on an individual or a small group of individuals. The point of political policies is that these should be adopted based on how it impacts the population at large, or the population that is affected by this thing at large, right? So why? So and you need to do this in emotions should not factor into that. Or sorry,
Your
the only
whole
emotion
heart.
that should factor into it is
Well, I
You-
disagree
do
with
you
the
not-
Biden administration
okay,
on
hang
multiple
on.
things.
Let me back up then, Dylan. I know we got to be direct.
no. Okay, this you don't need to be direct. You need to be specific. That's the problem.
Believe in mandatory vaccination?
Yes.
Do you not see the racism in that?
No.
Okay, so again, this policy is racist because it has a higher impact on this minority group than this racial group than this racial group. Okay, but is the impact positive or negative? Because we don't generally care if something's racist if it has a positive impact on that racial group.
You can say it's
But you
if you
see
want to
the
call it
raci-
authoritarian, you can call it whatever. Racism, I just think is silly. I just think it's name calling.
Here,
Okay, and so this is the misunderstanding from Dylan's part, right? He's not calling it racist because it's name calling. He genuinely thinks, and again, by their definition, this is racist. The problem is the negativity attached to that word, which is why they're calling it racist. So their logic makes sense, right? This is racist because it impacts this minority group more than, or this racial group more than these other racial groups. Okay, sure, that's an accurate interpretation of what racist means. The problem is this is not something we'd use to describe, or racist is not a derogatory term that you would ascribe to something that is beneficial. You worry about that because of the negative impacts of what a policy can do. So then the question is okay, if this is racist, right? Because we only care about whether it's racist or not when it's a negative impact, not a positive impact. What is the negative impact of this policy, which they don't discuss?
Well, if you're
and here's
forcing it
what-
on another
hold Hang
group,
on, hang
but-
on.
Also-
Okay,
white
and then
people-
he brought up this point, and then I didn't see who said it, but someone brought up, well, if you're forcing it, okay, like he just said, if you want to discuss whether a mandate is authoritarian or not, that's a separate discussion, and that's accurate, right? Forcing populations to do something by government mandate is authoritarian to a degree, but we are accepting of authoritarian policies to a certain amount, right? So, for example, speed limits are authoritarian. The government is telling you can only drive so fast. Having to wear a seatbelt is authoritarian. The government is telling you what actions you have to take while you're in a moving vehicle. And I mean, and this list can go on and on and on, right? So we are accepting of authoritarian rules or mandates or laws if the benefit to society at large is positive, right? Because what they're saying is you have to do this to protect you and other people around you, and that's what the argument should be about vaccine mandates, right? Is this level of authoritarian law, rule, policy, whatever, acceptable because of the positive impact to the society at large versus the negative impact to society at large? Oh, this webcam thing is just going to drive me absolutely insane. So anyways, continuing on.
Brento,
Oh,
white
hey,
people
slow
too.
down. Bro. But
Yeah,
white people, you even said it on your own stream. Majority of America is vaccinated because we're privileged. We can get to all these places. We don't have to show, like you laid out all the oppressions that are going to happen for people of color to be able to get the vaccine. You laid that out for me. So even if I use your argument, bro, why do we not have more?
So, the points Dylan made about why the black community is not as vaccinated as other communities, or more specifically the white community, was basically a lack of information, right? So, personally, I believe the prescription to that issue is, well, then whatever agency is in charge of this should be disseminating information better, right? If the main reason people are not not coming to a program, and the program is positive just in general, why are we not seeing the numbers that we want, or why are we not seeing the numbers that we would like to see, or why are we not seeing the numbers that we expect? Whatever the benchmark is, right? And so to me, what that boils down to is a lack of dissemination of information, which means that whatever agency is running the program didn't do a good enough job about getting the word out about how to take advantage of the program. Now, I have to hear what argument.
Why can't you help pop up some more pop-ups?
Okay, to be clear,
because the administration does not fucking want them.
So was that a hypothetical
That's
question
it.
or not a real question? Like, do you want me to actually answer it? You're very energetic, Redneck. Really good for a man at your age to be so energetic. Very happy for you.
Virulent. I'm fucking passionate and virulent.
So, I actually do participate in vaccine pop-ups in my community. I worked with PG Changemakers to get needles into the arms of people who needed them. It was... So I do it myself. I mean, like, literally what you're asking me to do, I do.
Sorry
That
to
was
derail, but
voluntary,
can
bro.
you define what PG Changemakers means? Because that's a new one for me.
PG Changemakers is a local organization in Prince George's County that gets involved in local activism and direct action through getting resources to people like medical supplies, PPE, food, and of course vaccine pop-ups. It's a very local organization.
Okay, so because you don't understand where I'm coming from when I say this is racist, it's because it's targeting. The mandate doesn't affect white America.
Yes, it does.
As much as it affects people of color more than it does white America, dude.
Okay,
The stats are
so-
there. I can even use your own fucking stats.
So
Okay, and again, I don't need to repeat myself, so let's just.
wait.
That's
If
the
that's
point.
if that's the case, then wouldn't it also be illegal to, like, say, arrest people for crime, since due to economic factors, black people commit crime at higher rates than white people? So
No, that would
enforcing-
not be related.
Wait, what?
Wait, but it's being disproportionate, Brento. It's a
It's
disproportionate
not. You
effect.
asked, would it be illegal?
No. Would it be?
Not would it be racist?
Would it be
He's-
racist?
he's
That's
arguing the
question.
racism.
Yeah. What? So,
Ooh.
Redneck, is it
Arguing
racist?
racism.
Is it racist to arrest for murder, Redneck?
Dylan.
Yeah. Look, it
The
doesn't
fact that-
hold up, does it? Just don't call me racist. Just call me authoritarian or something. This is stupid.
No. The fact that you can't comprehend that you will use the same argument to say that people don't need to have a fucking voter ID,
Is occurred.
yet
What?
turn right the fuck around. You turn right the fuck around and say, I'm gonna push something in your goddamn arm whether you like it or not, is unfucking fathomable in my mind
Wow.
to see you preach this liberalism of
You need to-
individuality.
you need to calm
You
down,
as a
buddy.
gay
Well,
bro, I'm just being passionate about the fucking facts. Pick a goddamn side, dog.
Okay, and that is a terrible argument. Pick a side. No. Pick a side on specific specific policies, specific arguments, specific points. Yes, but pick a side for your ideology as a whole. No. And again, this is why it is so important that we discuss policies on an individual basis. Your political team, your political party, your political affiliation should have zero bearing on what policy or what side of a policy's prescription you land on. Should not affect it. It's the opposite, right? The point of political parties is that we agree this is the general way of how to solve problems, and we agree this is the general way how to solve problems, right? And America has this backwards, right? Oh, well. And his rugged individualism thing, that's not what liberals talk about. This is what makes it particularly difficult for me to watch this stuff, is because these people don't even understand the rationale behind what they're talking about.
Hey,
What the fuck?
you know I really don't like that, and yet it's
Apologize,
happening.
GD.
And
Apologize, GD. Apologize.
it's an actual fact that more white men get shot by police than black men do
So,
during arrest.
Okay, and so. Okay, this is infuriating. Like most of the things we're going to be talking about, I'm probably going to use this. This is going to be a catchphrase for my channel. More white men get shot than black men during arrests. Yes, as a raw number, there are more individual white people who are shot during arrests than black people. As a percentage of police interactions and as a percentage of the population, that is not true. Okay, white people make up something like 76% of the population, which means that for this to be true, 76% of police interactions would have to be with white people. And of those, more of those interactions would have to which means that you'd have to have 76% of police interactions result in arrests or attempted arrests of white people, which then means that you would then, at that point, then have to have more white people shot during arrests than black people. And this is why, when statistics are used, they talk about per capita, why they talk about as a percentage of the population, as a percentage of whatever the statistic is in this case, arrests, and so on and so forth. If I have 100 cows and I have 5 chickens, and I kill 10 cows and 1 chicken, which one of my populations has been more heavily impacted by deaths, by my killing of the animals to have food? Well, the chickens. But I only killed 1 chicken.
So
If you want to go through the racist shit, yeah, it's an actual fact that more white men get shot versus black men do.
Okay, and so what this is an excellent example of post hoc justification, right? So this is where the bias thing comes in. So they've already reached the conclusion that the system isn't racist, or that policing isn't racist. And then so what they do is they then find the information that supports that point. And the reason why this is really important is because the human brain is really, really good at justifying things, right? And this is why you can have people have like horrible habits, or who do horrible things, or like have problems and then don't do anything to try and resolve them. The human brain is amazing at at doing this. And this is why post hoc justifications are so incredibly important, not only to point out, but to work against. Because if you're trying to have a rational discussion on policy prescriptions, you can't work backwards from your conclusion.
okay, so you're saying
During an
that
arrest.
cops are racist against whites then?
No, I'm saying
then
it's an
why-
actual
then why-
fucking
then-
fact
So why are you bringing it up?
that shit happens.
So why?
Okay, that's a bad argument. What he should have pointed out here was, well, wait a minute. You don't use raw numbers. You use percentages of population, or percentages of interactions, or percentages of whatever it is that you're talking about.
Why are you bringing it up?
He's saying it's not racism.
We're taking
not
it
that
as
cops are
not
racist against
fucking
whites.
racist versus black versus white.
Okay, so what if
Period.
I was to bring up the disproportionate number of black people on death row, or the disproportionate amount of black people charged?
Because 9 times out
There's
of
a
10,
difference between writing a law and it affecting one.
So there's a difference.
group
So there's a
of-
difference between.
Hold on, let me finish.
the vaccine-
There's a difference between
Okay,
creating a
okay,
law
right now,
and
you're all covering for
we didn't
bullshit.
speak,
Right
we
now,
let you-
you're all
you're-
covering for bullshit right now.
No, I don't think so.
No.
Well,
No,
Dylan, can I
wait.
just ask? Can I ask you a question?
Brento,
It's
you're
like-
usually somewhat sensible. I would expect
Okay.
more from you. Okay. Like-
Well, no. Just let me ask the question then.
What?
That's okay.
Okay.
But the question is, within the different types of like definitions of racism, I've heard, being on Twitch and talking to people, they say racism is anything that disproportionately affects communities of color negatively, even if it's just part of a system. And I'm like, okay, that sounds like that's their definition of racism. I don't necessarily agree, but that seems like a leftist kind of definition. And if this is doing that, how is this not needed?
This would be like saying it's racist against black people if we were to have social security programs that disproportionately helped them. Or it would be like saying it's classist to have programs that disproportionately help poor people. This program I'm talking about would disproportionately help black people. It isn't racist against them.
Within
because I'm
your
applying
definition
this
of helping
equally.
them, though.
Yes.
Can't they
Yes,
make the
because
choice for them? Why can't they make the choice for themselves?
Why can't they make the choice for themselves? Well, then let me ask you this question: are seatbelt laws racist?
No, but seatbelt laws are not a medical procedure. Seatbelt laws are not a medical procedure.
Okay.
They're not medical procedures.
Everybody, shut the fuck up. I'm talking to one person at a time. I'm not gonna talk to 2 or 3. Okay.
No, you don't tell me
Get
to
him.
do
You're
it.
wrong.
I will tell
Down.
you.
He's weak.
Look,
He's down.
I'll tell
Hold
you.
on.
Look, okay. I will tell you to do whatever the fuck I want to tell you to do. Fuck you.
Shut up.
Okay. Hey. If I gotta serve meat the whole fucking room, I will. Right? I need to just be able to play my game while y'all have this conversation. So,
Hmm.
okay. So, Dylan, Take it away. Well, I tell you what, Robe Man just joined the call. Robe Man, I don't think we've ever talked, so give me a brief description as to who you are and what's up.
Okay, my brief description is basically that these vaccine mandates are ridiculous. Everything that's going on right now is out of control. I don't understand where the country is at. I don't understand what we're doing. Why are we
I'll
doing
get
this?
to that.
I I I live in Massachusetts. I live in Western Massachusetts, and this is a liberal like paradise, I guess. And I just took a trip down to Florida. I saw the difference in the economic prosperity that was going on in Florida. They were just living life, having a good time. Everything was good. There was no COVID. I'm unvaccinated.
No
I
COVID in
would-
Florida.
Hold on, stop. You don't know what you're talking about. I
Yeah,
went
I'm
on
sure.
a plane. I went on a plane.
Oh my. Okay. This. The economic. Okay, so the point about economic prosperity is particularly infuriating, because what does he use to then back that up? Well, so to me, and maybe this is just we have different definitions of economic prosperity, but to me, economic prosperity means that the people have better incomes and therefore live better lives in general, right? They're able to buy better food, they're able to buy better quality products, they're able to more of their money or more of their income is discretionary spending, in which they can just spend it on whatever they want. Less of it is on bills and necessities. To me, that's what economic prosperity is, right? So, what information does he have to back this point? Oh, people are out and about. People are doing what they want. What does that have to do with economic prosperity? That's not economic prosperity. That's just social freedoms, right? So your evidence that they have more economic prosperity is that they have less laws and mandates on what you can and cannot do as a response to COVID. There's no connection there. So, and again, post hoc justification, right? He wants this to be true, therefore this information that he did see absolutely enforces this point. But that's not true, right? And it's demonstrably provable because have the residents of Florida, due to the laxer regulations and laws on what you can and cannot do because of COVID, resulted in better incomes for the people of that state than people of other states who, and obviously you have to have similar conditions, right? Or even has it resulted in them having better economic outcomes from previous years prior to COVID? But doesn't present any of the information, right? So this is the problem with there's no connection between his view that they have prospered economically and the information in which he uses to point that out. And this is where something like statistics and data and information is so important, right? If he has numbers to present to demonstrate better economic outcomes, then that's a point that's a provable point that he's making. But he doesn't give you any of that. What he does give you is things that he believes demonstrate that. But this is a huge problem when we have these discussions, because what we think demonstrates something is not necessarily true, right? So, literacy rates, okay? Literacy rates are often used as citations for, well, these policies lead to better education. Well, literacy is not the only part of education, right? And it's same like test scores, right? Like I know in California, they do state testing, and the entire education system is built around these state tests, and so the metric that they use is, are the students scoring better on these tests from one year to the next to justify the system of teaching them strictly to take these tests. The problem is what happens after they get out of school, right? So one thing that we know is that teaching students to take tests is not the appropriate approach for education. What you want to do for students is you want to teach them critical thinking skills. You want to teach them how to analyze a problem and then reach a solution. Because then what this does is this gets applied. You can apply this universally. What are effective methods of dissecting a problem and creating possible solutions? Which has nothing to do with test scores, which has nothing to do with literacy rates, which has nothing to do with the vast way that we teach or that we teach students. So the evidence that you cite to prove your point also has to correlate to it, outside of the specific parameters in which you've set.
Went down, unvaccinated, didn't have a mask on, was hanging out in a bar, was just chilling, doing everything, having a good time, came back. Everybody is so worried about a cold. That's what's happening right now. There are people in my area that want to have a vaccine mandate to go into businesses, all this stuff. Why? Why are you trying to regulate my body? Why does the left want to put their agenda into my body? What are you doing? What is the point?
Okay, these are his line of argumentation is so disconnected. I don't even know where to begin with this. Okay, so he makes a point about Florida being more economically prosperous without actually citing any evidence that would demonstrate that. Then he moves on to look at all these things that I could do because there were no laws and regulations against what we could do because of COVID. Okay, that's kind of self-evident. Like, that's the point. And then he brings it back to, well, and now I'm back in my home state, and these people want to do all these things and force their political views down my throat. Well, that's what laws and mandates are, dude. That's what governing is, right? It's
Dylan, you tell me why you think that you should have the right to tell me what to do with my body.
Okay, but this isn't about telling people what they can and cannot do with their bodies. What this is about is, what do you need to do to keep the people in your community safe from this disease, which you can spread to them without ever knowing that you have it. And I don't know how else we can discuss this when it's like, okay, so, and it's funny how more and more and more of these discussions follow this premise. This is like abortion debates, right? If you understand anything about abortion debates, or just the very surface level of abortion debates, you are pro-life or you are pro-choice, right? So it's not pro-life, anti-life, and it's not pro-choice, anti-choice, right? Both sides are for something specific, and it has nothing to do with what the other side is talking about, right? So the conservative argument about abortion is about life and murder and is this just not going to work now? Okay, it's working. Nope. And of course, it's going to drive me. Forget it. I'm done. Yay, technical difficulties. Okay. So, pro-life arguments are, well, life begins at conception. By killing a fetus, you're killing a life. We should protect life. All life is sacred. Every life should have the opportunity to grow and then live, right? And what's pro-choice? Well, pro-choice is, well, what's happening to the woman's body is should be up to her because it's her body. Your views on where life begins and how life sacred is should not have any bearing on. Actually, I'm not even phrasing that correctly. Because pro-choice is, well, it's her body. She should get to choose what she does with her body, right? And that's the premise of both arguments. But neither one of them is talking about the same thing, right? And so what you end up with is discussions on which opinion is of more value. Is the sanctity of life, where it begins and how we should treat it, more important to our society than the value of a woman should get to choose what happens with her own body. So, and this is, again, these are discussions we're having, right? So he's talking about, well, why do you get to choose what gets put in my body? Well, no, that's not what that side of the aisle is talking about. They're not talking about, I should get to choose what goes in your body. It's, you have a personal responsibility to the community at large. You have a social responsibility to the people around you to do certain things to protect you from harming them unintentionally.
Number one, you all need to calm the fuck down, okay?
No, it's not calm. It's not calm down because you're telling me. I need to do something.
Look at him. Look at him.
Bro. Jesus, bro.
Look, okay? I actually think now we need a second mandate, and the second mandate is chill pills, because you all need to take them. Okay?
No, it's not a chill pill. It's not a chill pill.
Signature mandate, right there, Dylan. Both of them.
I haven't said a word.
There's my second mandate. Okay, it's chill pills. Now,
Buckeye hasn't said a
Mandate
word
one,
either.
Mandate two.
okay.
Mandate 1, mandate 2. There you go.
It's only
Okay.
because the shoes on the other
Okay.
foot.
Wow, you're all very smart. Okay, now the thing is, I believe that since COVID is the second largest death contributor to death in this country right now, I think that's not a good thing. I think that's a bad
No,
thing.
it's not.
800.
It's not. It's not.
It's
Okay.
not.
Prove it.
You're wrong.
Anyway, let me finish. But okay, no.
Okay, so notice how there's no cited information, there's no data, there's no statistics. It's not. This is the worst way you could ever argue anything. Oh, it's just not. Okay, how did you arrive at that conclusion? What information do you have that informed you this is the accurate conclusion? And none of it's presented. Because if you've ever had an argument with somebody about this stuff, the very, very first thing you do is when you say no, or like when you counter their conclusion, you have the evidence that led you to yours. Please cite your evidence that led you to your conclusion.
Number one, okay, look at them. CTV, okay? I thought this was the Law and Order Discord. I thought this was the conservative Discord.
I
Yeah.
was wondering
Look at these fucking lefty rioters, okay? I need the cops to come in
saying
here
it's wrong.
and disperse these people, these anarchists, okay? Okay?
Really?
Anyway,
Okay.
800 over 800,000 people have died due to COVID in some way or another.
Through the
And-
world,
oh my
not
God.
the U.S.
No, that is the U.S., dumb fuck. Shut your mouth, okay?
Oh my
Number
God,
one.
we're gonna listen to the fucking CDC and listen what the hell these
Okay.
retarded fucks have to say, which
Wow,
they're
man.
not right at all.
Mandel, you're not allowed to talk until you get to find ignorance, dude.
Okay,
Can I say something?
look at
Yeah,
this.
it's number 2.
Can I
People are
say
just making
something?
noises
Okay,
at
look,
each other now.
You're
That's
gonna
weird.
get my respect when you respect me. If we all calm down, okay, lower our voices, okay, and don't scream at me like you're my dad, okay, like you're telling me to go clean my fucking room, then I'll respect you and I'll talk to you guys like you're human beings. We can have a conversation. But there's 1, 2, 3, 4, 5, 6, 7, 8 people in here who probably disagree with me, okay? I'm one person, okay? So if you're
I'm
coming in
neutral
here,
right now.
okay,
I'm neutral.
then
Yeah,
7.
Twitch, buddy.
There's a lot of people, okay? So if I'm gonna talk to people, you need to calm down and just chill and ask me the questions one at a time so I can answer them. And when I start to answer them, you don't interrupt me while I'm trying to talk, okay? So let me answer your question. The reason why is
Milwaukee.
That Omnicron, #1 killer of anything.
I never called it the #1 killer. Okay. Okay.
Dude, first of all, there's
Anyway.
no N in there.
Jesus
Okay,
Christ.
Dylan's gonna finish.
Is it the #3
Oh.
killer?
CTV.
Dylan's gonna
This is great.
finish.
This is great, CTV.
Dylan's gonna finish.
Okay, so
All right.
when it comes
Who
to
let Dylan finish? But
Shut
you're
the
drunk.
fuck up, Milwaukee!
making no
Shut up!
sense.
This guy's drunk as fuck.
Shut up!
Ranger, you
Makes
can mute him.
no
Yeah, okay. Now Ranger's like, damn it, I've got a sword. I'm gonna fucking use it.
Fuck, man. Let the man talk.
okay,
Well, his name is Milwaukee.
so when it comes to vaccines, I don't think it's as simple as a personal health decision, since this is something that is killing hundreds of thousands of people and is an infectious disease. It gets people, it grabs them, and doesn't only kill them, but it has long-term health effects when it comes to heart problems, lung problems. Of course, there's the more minor stuff like taste and smell. And due to all of these health effects and the fact that it's killed over 800,000 people just within the United States, internationally it's in the millions, I think since this is something that can be spread around, we need to deal with this since you can give me and I can give you COVID. That's the first reason. Second reason, and this is a big one for me, probably the biggest, it has to do with the overburdening of our healthcare system. There are healthcare hospital systems in Pennsylvania right now operating at 110% capacity, and they say that about half of the people in their hospitals are the unvaccinated. You talk about Lindsey Graham's state, he said in a crowd of people, like, hey, 92% of the people in our hospitals right now are the unvaccinated. They are burdening our healthcare system, bringing it to the brink, and we're having delays of 10 to 22 hours for emergency room visits when we're talking about Pennsylvania. And that's just Pennsylvania. And so for me, seeing our healthcare system pushed to the brink by something that could be lessened by vaccines, it isn't simply a decision about personal choice, since this is stuff that can kill other people by people deciding to make the, I guess, personal choice to not get vaccinated and end up in a hospital. And
Okay, so basically, he said what I said earlier, right? So the argument is this isn't about personal choice. From their side of things, this is about what responsibilities do you, as a member of a community and as a society, have to the other members. And so here's where the conflict comes up, right? Because the other argument is, well, you shouldn't get to tell me what I can and cannot do, and what I have to put in my body and what I don't have to. These are two totally different things, right? Yes, one kind of leads the other in that, like, what is your responsibility, and then that leading into, well, if your responsibility is to protect the community, and this is like, and you protect the community by taking the vaccine, which is putting something in your body, then yes, I am telling you that you have to do this to keep, or I'm telling you have to do this with your body, right? But there's more to it than I'm telling you what you have to put in your body, right? I'm telling you have to do this because it protects other people. In the same way that, well, why do you have to obey a speed limit? Or why do you have to go through, employers. Employers bear responsibility for their employees, keeping them safe, right? OSHA. There are OSHA laws. A company has to invest a certain amount of money and a certain amount of resources to protect its employees from getting hurt while they're working, because we believe that is better for society at large. So they're not arguing about the same points, which in my opinion, means they're never going to reach an understanding here, because they're not arguing on the same lines of thought.
this is something that's hurting other people who have diseases like cancer, car accidents, got shot, got a case of the stabbies. So that's why I feel this.
Wait, Lindsey Graham represents Pennsylvania?
No, that was a different state.
May I ask, only one person fucking answer his whole statement? That would be Redneck.
Hey, Dylan, can I ask you what you did 3 years ago when you were sick? Did you walk around with a mask? Did you worry about what the person sitting next to you had? Did you really go to the doctor if your nose starts sniffling because you were afraid of a fucking cold?
When was I sick 3 years ago?
Let me fucking answer your fucking comments. You made the assumption that all that shit that we're sitting here living like didn't fucking happen before. 3 years ago, we were all having colds and flus, and people were fucking dying in the hospital with...
Okay, this is... I may just skip his rant here. You can just point to Japan, right? What do Japanese citizens view their responsibility to their community very, very highly, as opposed to Americans are much more individualist, right? So, what does this translate to? Well, when a person in Japan has an infectious disease and they know they have an infectious disease, even something as simple as the cold or flu, if they have to go out in public, they wear masks. So this is a terrible line of argumentation, because all you're doing is leaning into Dylan's point. Dylan's point is, how much of a social responsibility do you have as an individual, as a member of a group, to protect other members of the group from something you might give them? And he's arguing, well, we didn't do these things years ago. Okay. But if our argument is we weren't doing these things years ago, then we would never make any progress. Nothing would ever change, right? Like the argument is that the argument that this is how it used to work is a terrible argument, because things always work differently, especially when we learn new information, especially when something new comes into the picture.
Cancers and others goddamn comorbidities because of a fucking pneumonia, because of a cold, because of a flu. Sorry, GD, didn't mean to. I'll try to work on it, I promise you. Dylan, you're hyperbolicing the bullshit of COVID, which is an oversell. We have a 99...
I don't... Hyperbolic? No, that's not what that means, Redneck. Please try again.
Point X. The fact that there is no stat that shows less than 98, even for people with comorbidities over 65, is at 98%. There has not been an illness, not been one effing illness that has been that light other than the common cold. So yes, when you guys want to sit here and
wow.
and say, oh,
I'm blown away by his blatant factual I can't call that anything other than a lie. Well, I mean, maybe he doesn't know. Let's look that up. Death rates for flu. That's fine. Rate per 100,000. Oh no, I don't want. I wanted. All right, this isn't helping me find it. Also, he's wrong about the COVID mortality rate. Okay, so he was saying that we've never had a disease that's even. Okay, what 2,000 versus almost 200,000? And what are percentages? No, there we go, by age. Okay, this is the total number of deaths. But I wanted. Oof, that's a horrifying number. Here we go. Case fatality. Oh, but this is as a whole. Is there a breakdown? Okay, here we go. 60 million cases. Oh, but this doesn't break down by age. Can I do by age? Okay, this, but so this information right here should be terrifying, right? So heart disease is the biggest killer in America, has been for a very long time. I think cancer is on the rise, but cancer's always been kind of a big thing, right? But these are very serious conditions, right? Look at this. This is horrifying. This is just another cold. This is just another flu. Why is it beating out stroke? Why is it beating out respiratory disease, Alzheimer's, diabetes, pneumonia, septicemia? Like, again, they keep talking about like this is not a big deal, guys. This is a big deal. If this is just another cold, if this is just another flu, a 2% mortality, even if he's right and that's a 2% mortality rate, that's a horrific. Like, let's look up flu mortality rate. Okay, so this isn't even 2%. What is it? 22 per 100,000 is like what, 0.02? So like, guys, this is not just another cold or flu. Like, why are we comparing these things? This is like a million times more deadly than even. And these are at-risk groups. I don't understand this line of I can't even explain this line of argumentation.
We've had 800,000 deaths. Yes, SARS is real. Yes, it affects the lungs. Yes, it's a tough fucking flu. But you know what used to happen?
It's not a tough fucking flu. It's 100,000. I'm sorry. It's 10,000 times deadlier than the flu.
Happened before COVID. Every 2 or 3 years, we would have a bigger flu season. We would have a pretty bad flu season. If you went back and looked through the numbers, you would see peaks and valleys just like a stock market. You would have highs and lows. All of this shit that you're saying, we're overloading the system, is because of you. All of y'all that got vaccinated were like, oh, we're immune to this thing, so we're going to keep just chugging along. Y'all didn't even expose yourselves properly. Y'all were mocking those of us that got COVID early, those of us that didn't mask, those of us that didn't have vaccines, those of us that
got COVID early. So you intentionally went out and caught an infectious disease so that you wouldn't have to go to the hospital later when everybody else caught it? Like, I can't even follow his logic here.
weren't practicing your safe living. You were mocking us, yet we're superstars. We're the ones that they're coming to now to go, oh, well, this new variant can't be controlled by our vaccines. It can't stop it from spreading. It can't stop it from this. It can't stop it from that. Your only pitch to me right now is that it gives you a better chance of not dying.
No, that's always been the pitch. The vaccines never stopped people from getting infected. They've reduced infection rates, and they lessened symptoms, or they prevented the more severe symptoms from presenting, but they never stopped infections. I don't even know where he's getting this. I don't want to say this is a mischaracterization, but like I don't have any other way of explaining this, right? Like this is a misunderstanding of the arguments being made by an opposition argument. Like this is not what was being said. I don't know where he's hearing this from, and if anyone is saying this, that's just dead wrong. Like the vaccines have never stopped infection. They've reduced infection rates, and they've reduced the severity of the cases in which people did get sick, which means that they've reduced hospitalization rates, which means that they've reduced the death rates. But this is what I talked about earlier with the mitigation stuff, right? I don't know for whatever reason, if you cannot stop it completely, there's no point in doing anything in their minds, and I don't know why.
That is your only fucking comment out of all of your bullshit that you're getting. And you know what that is? That is fucking fear. And just because you live in fear doesn't mean the rest of the goddamn society needs to live that way. It's bullshit, Dylan.
Okay, so number one, okay, what he just said also is just wrong. So when it comes to vaccines, okay, the vaccinated are the people who are not overburdening the healthcare system. 92% in Lindsey Graham State, 92% of the people in the hospitals in that state are the unvaccinated. We have 110% capacity in the state of Pennsylvania in some hospital districts. We have 50% being the unvaccinated when the majority of Americans, 72%, are vaccinated. It's a disproportionate amount of the unvaccinated that are making up hospitals. What he's saying about superstars? I mean, maybe. I see a lot of people on ventilators on CNN. I guess you're a star then. You made the news. Congratulations. A lot of anti-vax radio hosts have made the star. Why? For being put in the ground.
You realize,
Currently,
do you
with
realize that the stats that you're
with the
giving,
new Omicron, no one's vaccinated.
hang on, but
No. The vaccination. It's called a new strain. The vaccines were not designed with this strain in mind. That's how it's always going to work. Viruses evolve. It's like saying you got the flu shot, and the next year comes around, and then you're not vaccinated against this flu because it evolved. I can't even analyze the points being made here because some of the stuff is just so infuriatingly uninformed.
Dylan, do you realize the stat you're giving? 72% of America's vaccinated. Do you realize that your status of being vaccinated went out after the first, unless you got 2 boosters now? You're not vaccinated unless you have 2 boosters. So don't sit here and talk
Wait,
this moral
when did I get
high ground
vaccinated?
bullshit.
You don't even know when I got vaccinated.
I'm not talking about you specifically.
That's right.
Dylan.
You're
The
not. You're
topic
you're
is-
anti-vax. So.
I'm talking about
Joke.
if you do not have, per CDC right now, if you don't have the second booster shot, you are labeled as unvaccinated. Yes.
That's not true.
No,
That's not
true.
even. That's not. It's literally just a lie. Okay, look
It's
it up. We can talk
worth
about.
it,
Okay,
though.
wait.
It's worth
Okay, shut up. There was 2 people who just talked to me. Okay, there was this guy on the bottom here, and then it was redneck. So, you said it doesn't protect against Omicron. That's not true. Okay, vaccines have been proven to resist against Omicron.
If you
It has
do not
been
have
proved.
the
That's
second
proven.
booster, you're not
That's
vaccinated.
proof. Wait,
if you don't have
wait,
2 boosters,
Just to
Redneck,
correct my
I'm
point.
trying to answer somebody else's question because both of you asked me things. Okay, so one person said that. That's just not true. When it comes to Redneck saying, send me right now that they list people who haven't had 2 boosters as the unvaccinated. Because you claimed a lot of things in our discussion like 2 hours ago that just end up not being true. You claimed that it's just public news, that it was made in a lab, and that's just proven. That was wrong. You didn't have evidence for that. You said that the CDC admitted that vaccines don't work. That was wrong. You didn't have proof for that. So send me proof, because I don't believe literally anything you said. Yes, you did. You want to do it? You can rewind the clip.
I
Shut
said
up.
that.
Hold on.
Dylan,
Hold on.
correct my
Hold
point.
on.
Hang on.
Shut the
Dylan.
fuck up for a second. Listen, look, if you guys are going to talk, then talk. Now, number 1, I'm an anti-vax person. I don't believe in that bullshit. But if you guys are going to have a civil fucking discourse between one another, let one fucking speak and then let the other speak.
Yeah, and I kind of find
Let
it like if I need to
conversation
actually
happen.
start, hold on, just look. If I need to start talking, then it's stopping the conversation, and it's just me kind of getting the tone turned around to the kind of tone that
Come
I'd
on.
like to have in the call, right? So
Don't yell
this
at
is
one
not shut
another.
that. So this is the kind of tone that I'd like to have in the call. So if the rest of you can maintain your tone right about here, we can continue to have a good conversation. Frames, feel free to jump in here as well, buddy. I see you in the chat. And from time to time, I may interrupt everything that everybody is saying to address chat specifically because I'm paying attention to chat while we're also doing this, right? So somebody take it from the top, and we'll go from there.
I just want to make one point
Destiny
where
wants to join.
I want to ask a question. I just want to ask one question
Destiny's
of Dylan.
more than welcome
By the
to
way,
join.
somebody asked for the source. I'm linking in my chat for the 92%. This is Lindsey Graham giving a speech about it to the crowd. And he, of course, cited CDC data. Continue.
So Dylan, I have a question for you. If you're for the vaccine mandate, let's say it has to get to 6 boosters. Are you okay with having to get your 6th booster? Are you okay with that, like having to be mandated?
Yes.
Why? So when does it end for you? If let's say it gets to 12, 14, 16, 18, do you continue to just say, let's keep putting this juice in our body and hoping that it just makes us better?
Yes.
Yes, because I'd be interested to know if he believes that we shouldn't do flu vaccinations on a yearly basis. Because it's just, you're just, same line of thinking there. Like,
Where does it end?
That's what an inhibitor is. You need to understand the science before you have a take on it.
What do you mean by the inhibitor? This is what I'm saying. So I'm just supposed to just accept that this new science miracle is gonna just protect me from everything.
it's not a new science. Oh my god. I'm glad I didn't get this far in. I would have lost my shit. not a new science miracle. We've been doing vaccinations for literally hundreds of years. Secondly, why is this your logic on COVID? But we've been doing this for the flu for freaking forever, since I've been alive, my entire life, if like longer than that, and I'm almost 40. Like,
But when at the same time,
That's what science
Literally
is.
nobody
Yeah.
claimed it.
can I finish? Can I
Except that it doesn't, though.
We
But
asked
go
you
ahead.
two
Can I finish? Can I
questions.
finish?
Okay,
Can I
sure,
finish?
Can finish.
The Omicron variant is infecting people who are vaccinated and who are boosted. So if we continue to get it boosted, what is the problem? And you're gonna tell me, oh, it's to overload the hospital. So are you also agreeing that overweight people and people who smoke and people who drink should be shunned? Is that what you're
Okay.
saying as well?
Yes, actually. You don't know my position on health issues. So
I'm asking you.
So the first thing I want to say is I don't know if I would call it a new science miracle. Like, I mean, you could say that about insulin. You could say that about like any amount of medical developments.
so-
But let me come on. Let me finish. Okay.
Go
You
ahead.
could say that about anything. You call it a new science miracle. Or use whatever terms you want to. Personally, yes, it is a miracle that we were able to develop this so fast. I think it's a gift. I think it's one of humanity's greatest achievements. Just like Donald Trump said, I agree with Mr. Trump. I guess maybe it's just because like I'm a Republican now. But the second thing is my position actually is that we should have national programs to decrease the rates of overweight and stuff. For example, I believe in like expanding gym classes in youth and having mandatory like health education classes, expanding that in like education. Like there's a lot of things that I should do because I believe if I want to one day have like universal health care, universal public health care, then you're gonna have to deal with some of the chronic issues we have as a society, definitely when it comes to overweight and like health issues, if we're gonna be able to actually cover the cost that would endure. This is like a thing when it comes to Europe, for example. Like like the more chronic health issues we have in the country, the more it's gonna cost for healthcare. And so I do want to deal with those, tackle them head on. Wait, let me just be clear. Do I know the specifics about how I'm gonna like tackle those in all those different ways? I don't know the specifics. I haven't like sketched one out for like how do we tackle like people being overweight and stuff like that. Like we can like pose hypotheticals, but like I don't know if I really commit to a hypothetical right now. I'm just saying that yes, I do believe there should be some mandatory programs when it comes to weight issues, for example.
So following your reasoning, you're saying that the vaccine should be mandated. You're also saying that fat people should be mandated to get skinny.
Okay, I didn't say they should be mandated to get skinny.
Well, that's the same. That's the same avenue that you're going
Okay.
down. That's exactly.
okay, and this is a misunderstanding of what he's saying, right? So there's a difference between requiring something and encouraging something, and he's what is this? Rogue Man is basically saying the same thing, and that's not the case. And this difference so far from. So Dylan is basically saying he believes that if we want to have a universal healthcare system, that means that everybody's covered. Resources are still an issue, right? Because every healthcare system, what's the word I'm looking for? Rations healthcare, right? It's just about what resources do you use to ration it. So in a universal healthcare system, it's rationed by necessity, by need. So elective surgeries, and of course this you don't really get to this point till like near the end of the years with these things, anyways. But elective surgeries are on the bottom of the list. Diseases that don't require serious treatment are put towards the bottom of the list as far as this stuff goes. So what he's saying is his view on this is that if we use a system that gives assistance, medical care to anyone who needs it, one of the things that we want to do to help with rationing care is to have a general culture that incentivizes being healthy. And the way we achieve that is through educating people on healthy diets, on healthy lifestyles, and encouraging them when they're young, because that's when we make habits, or that's the easiest time to create habits for people. And then what I find interesting is what Rogue Man hears is, okay, so you're saying that the government is going to mandate that everybody be healthy, and like that's not the same thing, but two, this is again pushes into that what I was talking about, where like you either do something or you don't do anything kind of mentality that conservatives have for whatever reason. That oh my god, I'm only 30 minutes into a 2-hour video. I'm probably just gonna stop this because I'm gonna go for now. Yeah, so this circles back to what I said very early on. That rather than this being about how do we mitigate problems, how many. So having worked in safety for many years, there's a technique that they call the Swiss cheese method, or I'm sorry, not technique, a system. It's called the Swiss cheese method. And so basically what it means is, so then the way that Swiss cheese has holes in them, what you do is you create layers of protection for certain activities, right? And so the explanation is, maybe I can actually put this up. Okay. So here we go. This is an excellent visual. Okay, so this is how mitigations work, right? So you have a problem, and you create layers to try and stop the problem, right? So as you can see, the arrows kind of show like how the thing works. So what you do is you have one method to prevent things, and that method isn't obviously going to be able to stop everything from getting through, but it's going to stop a big chunk of it. And then what you do is you design another layer, and ideally that layer also has protections that stop things. But again, it's also not going to do that cover everything. And you do that again and again and again. And then what happens is, when you layer enough of these together, you end up with a system that prevents the vast majority of problems from coming through all of these holes, right? So, and these holes are lined up to demonstrate, but this is one of those things where like, this is a good representation of one of those happenstances that you can't prevent because the stars align, right? Like, again, so having worked in safety and actually this is specifically about safety. That's interesting. Yeah. So what you do, okay, I'll just walk through this real quick using my expertise. So the first thing you do is they're called engineering controls. So this is designing the workspace, designing the project, designing the materials, the tools, anything that you can like fabricate or create in a physical sense. That's what you use. So the first step is engineering controls. How do I design the process and the materials involved in the process to be as safe as possible? And then the next thing is administrative controls. And so this is what processes do I have in place, what procedures do I have in place, so that people do safe things with these safe materials and these safe tools, right? Sign out or sheets that you have to sign, forms that you have to fill out. Again, processes. So like, I have to go talk to this person to make sure this thing's shut off before I go do this thing. So that's the next step. And then the next step is behavioral control. So this is teaching people the proper use for equipment. This is teaching people what PPE they need, the personal protective equipment. This is teaching people safe behaviors. This is teaching people safe processes. This is teaching people to be aware of things, right? And then after behavioral controls is, then the last thing is, what do they call it? Substitutions, right? So am I able to swap anything out in as a final step here that I couldn't here? So like, is there a different material that I can be using? Is there a different way I can be using that material? Is there a different way I can be using that tool? Is there a different way I can be following this process? Like, yes. And then obviously, when something slips through all your mitigations, then you have an accident happen. So this is where I get annoyed with these conversations, or the way they discuss these things is like, you know, they don't understand that this is how things work. That this is how you prevent problems, right? You do as many things as you put as many obstacles in the path as possible to prevent a thing from getting through. And yes, some things are going to get through. one of the most important things that you'll ever learn about safety is that there is no way to 100% prevent an accident from happening. That's why they're called accidents, right? What you do is you put as many obstacles in the path as possible so that a human being has as much protection as possible so that there are as few accidents as possible. And so this all or nothing view on things is just absolutely batshit to me. But anyways, so I'm going to leave it here. I will stream this one again, hopefully go over some more. I do feel like I'm being incredibly biased as I cover this video. I haven't talked a lot about Dylan's stuff, and I may make a better effort on as far as that goes. Primarily because Dylan makes arguments along the same lines of thinking that I do, and so I don't have to think about it. I don't have to analyze it. So I do need to work on that. But